What is the largest bone in the lower limb? Your options are femur, tibia, fibula or patella. The correct answer is A, that is femur. The femur or the thigh bone is the longest and strongest bone in the human body, forming the primary structural support for the lower limb. Question number 2. Which muscle is the primary flexor of the hip joint? Your options are gluteus maximus, iliopsoas, rectus femoris or sartorius. The correct answer is B, that is iliopsoas. The iliopsoas, composed of the iliacus and psoas major, is the strongest hip flexor, and critical for walking and running. Question number 3. The knee joint is classified as which type of joint? Your options are ball and socket, hinge, saddle or pivot. The correct answer is B, that is hinge. The knee joint is a synovial hinge joint. Allowing flexion and extension with slight rotational movement. Question number 4. What structure prevents anterior displacement of the tibia? Your options are medial meniscus, anterior cruciate ligament ACL, posterior cruciate ligament PCL or lateral collateral ligament LCL. Answer is B, that is anterior cruciate ligament ACL. The ACL, known as anterior cruciate ligament, stabilizes the knee by restricting anterior movement of the tibia relative to the femur. Question number 5. Which artery supplies the majority of blood to the lower limb? Your options are femoral artery, popliteal artery, external iliac artery or dorsalis pedis artery. The correct answer is A, that is femoral artery. The femoral artery is the main arterial supply to the lower limb, branching into major arteries like the popliteal and deep femoral arteries. Hello friends, welcome back to Dear Competitive Exam YouTube channel. Today you are attending 100 most repeated and most important question answer session based on lower limb. And this is the part 1 of this series. So let's challenge your quality of learning. Let's see what will be your score from this part 1. So do watch this video completely to make yourself more fit to answer any kind of question. And at the end, if you find this video helpful, then please do like, subscribe and share this video to all your friends who are preparing for upcoming any kinds of medical exams. Let's continue. Question number 6. Which nerve innervates the quadriceps muscle group? Your options are sciatic nerve, femoral nerve, obturator nerve or tibial nerve. The correct answer is B, that is femoral nerve. The femoral nerve arises from the lumbar plexus and innervates the quadriceps, facilitating knee extension. Question number 7. The Achilles tendon is formed by which muscles? Your options are gastrocnemius and soleus, tibialis anterior and posterior, fibularis longus and brevis, fibularis longus and brevis, or extensor digitorum longus and brevis? The correct answer is A, that is gastrocnemius and soleus. The Achilles tendon, the strongest tendon in the body, anchors the gastrocnemius and soleus muscles to the calcaneus. Question number 8. Which muscle is the primary extensor of the hip? Your options are gluteus medius, gluteus maximus, tensor fasciae latae, or hamstrings. The correct answer is B, that is gluteus maximus. The gluteus maximus is the strongest hip extensor, crucial for movements like climbing stairs and rising from seated position. Question number 9. What is the function of the medial meniscus in the knee? Your options are prevent hyperextension, shock absorption, stabilize the patella, or flex the knee. The correct answer is B, that is shock absorption. The medial meniscus is a fibrocartilaginous structure that cushions and stabilizes the knee joint during weight-bearing activities. Question number 10. The sciatic nerve splits into which two main branches? Your options are femoral and obturator nerves, tibial and common fibular nerves, pudendal and gluteal nerves, or saphenous and sural nerves. The correct answer is B, that is tibial and common fibular nerves. The sciatic nerve fabricates near the knee, forming the tibial and common fibular nerves, which innervate the leg and foot. Question number 11. Which ligament connects the femur to the acetabulum? Iliofemoral ligament, pubofemoral ligament, ligamentum teres, or ischiofemoral ligament? The correct answer is C, that is ligamentum teres. The ligamentum teres connects the femoral head to the acetabulum and carries a small artery to the femoral head. Question number 12. What type of joint is the ankle joint? Your options are hinge, pivot, saddle, or ball and socket. The correct answer is A, that is hinge. The ankle joint is a hinge joint that allows dorsiflexion and plantar flexion. Question number 13. Which muscle is known as the Taylor's muscle? Your options are sartorius, rectus femoris, biceps femoris, or adductor longus. The correct answer is A, that is sartorius. The sartorius, the longest muscle in the body, assists in flexion, abduction, and lateral rotation of the hip. Question number 14. What is the main function of the fibula? Your options are weight bearing, muscle attachment, shock absorption, or joint stabilization. The correct answer is B, that is muscle attachment. The fibula primarily serves as a site for muscle attachment and provides lateral stability to the ankle. Question number 15. Which artery can be palpated behind the medial malleolus? Your options are posterior tibial artery, anterior tibial artery, dorsalis pedis artery, or popliteal artery. The correct answer is A, that is posterior tibial artery. The posterior tibial artery runs behind the medial malleolus and is commonly used to check peripheral circulation. The plantar fascia supports which arc of the foot? Your options are medial longitudinal arc, lateral longitudinal arc, transverse arc, or all of the above. The correct answer is A, that is medial longitudinal arc. The plantar fascia is a thick connective tissue that provides support and elasticity to the medial longitudinal arc. Question number 17. Which nerve is commonly compressed in piriformis syndrome? Your options are femoral nerve, sciatic nerve, obturator nerve, obturator nerve, or tibial nerve. The correct answer is B, that is sciatic nerve. In piriformis syndrome, the sciatic nerve is compressed by the piriformis muscle, causing pain and tingling down the leg. Question number 18. The femoral triangle contains all of the following except femoral artery, femoral vein, sciatic nerve, or femoral nerve. The correct answer is C, that is sciatic nerve. The sciatic nerve is not a part of the femoral triangle. It runs posteriorly through the gluteal region. Question number 19. The unhappy triad injury involves damage to which structures? Your options are ACL, PCL and patellar ligament, ACL, MCL and medial meniscus, LCL, PCL and lateral meniscus, or ACL, MCL and lateral meniscus. The correct answer is B, that is ACL, MCL and medial meniscus. This injury commonly occurs during sports and involves tears in the anterior cruciate ligament, medial collateral ligament and medial meniscus. Question number 20. Which muscle group is responsible for dorsiflexion of the foot? Your options are calf muscles, anterior compartment muscles, lateral compartment muscles, or posterior compartment muscles. The correct answer is B, that is anterior compartment muscles. Muscle like the tibialis anterior and extensor digitorum longus are involved in dorsiflexion. Question number 21. The popliteal fossa is bordered laterally by which muscle? Your options are semitendinous, semitendinosus, semimembranosus, biceps femoris, or gastrocnemius. The correct answer is C, that is biceps femoris. The lateral border of the popliteal fossa is formed by the biceps femoris muscle. Question number 22. Which ligament stabilizes the medial side of the ankle? Your options are deltoid ligament, calcaneofibular ligament, anterior talofibular ligament, or plantar calcaneonavicular ligament. The correct answer is A, that is deltoid ligament. The deltoid ligament is a strong triangular band that stabilizes the ankle medially. Question number 23. The obturator nerve primarily innervates which muscle group? Your options are hamstrings, adductors, quadriceps, or plantar flexors. The correct answer is B, that is adductors. The obturator nerve innervates the adductor muscles of the thigh, such as adductor longus and magnus. Question number 24. Which structure connects the patella to the tibia? Your options are patellar ligament, quadriceps tendon, cruciate ligament, or collateral ligament. The correct answer is A, that is patellar ligament. The patellar ligament anchors the patella to the tibial tuberosity and aids in knee extension. Question number 25. What type of bone is the patella? Your options are long, flat, irregular, or sesamoid. The correct answer is D, that is sesamoid. The patella is a sesamoid bone embedded within the quadriceps tendon to improve leverage for knee extension. Question number 26. The foot drop is caused by damage to which nerve? Your options are common fibular nerve, tibial nerve, femoral nerve, or sural nerve. The correct answer is A, that is common fibular nerve. Injury to the common fibular nerve affects the dorsiflexion, leading to a foot drop. Question number 27. The lesser trochanter of the femur serves as an attachment for which muscle? Your options are iliopsoas, gluteus maximus, rectus femoris, or tensor fascicle latae. The correct answer is A, that is iliopsoas. The iliopsoas attaches to the lesser trochanter, enabling hip flexion. Question number 28. The lateral malleolus is part of which bone? Your options are tibia, femur, fibula, or calcaneus. The correct answer is C, that is fibula. The lateral malleolus is the distal end of the fibula and contributes to ankle stability. Question number 29. What is the primary movement of the tibialis posterior muscle? Your options are dorsiflexion, plantar flexion and inversion, eversion, or toe extension. The correct answer is B, that is plantar flexion and inversion. The tibialis posterior supports the medial arc and aids in plantar flexion and inversion. Question number 30. Which artery forms the dorsalis pedis pulse? Your options are posterior tibial artery, anterior tibial artery, popliteal artery, or femoral artery. The correct answer is B, that is anterior tibial artery. The dorsalis pedis artery is the continuation of the anterior tibial artery and is palpable on the dorsum of the foot. Question number 31. The strongest ligament of the hip joint is pubofemoral ligament, ischiofemoral ligament, iliofemoral ligament, or ligamentum teres. The correct answer is C, that is iliofemoral ligament. The iliofemoral ligament is the strongest ligament of the hip joint and prevents hyperextension of the hip. Question number 32. The lateral collateral ligament LCL stabilizes which joint? Your options are hip joint, knee joint, ankle joint, or pelvic joint. The correct answer is B, that is knee joint. The LCL stabilizes the lateral aspect of the knee joint and prevents varus stress. Question number 33. The gluteus maximus is primarily responsible for hip flexion, hip extension, knee flexion, or hip abduction. The correct answer is B, that is hip extension. The gluteus maximus is the largest muscle of the gluteal region and is the main extensor of the hip. Question number 34. The primary nerve supply of the posterior compartment of the thigh is the sciatic nerve, femoral nerve, obturator nerve, or common fibular nerve. The correct answer is A, that is sciatic nerve. The sciatic nerve innervates the hamstrings, which are located in the posterior compartment of the thigh. Question number 35. Which structure forms the Achilles tendon? Your options are gastrocnemius and soleus muscles, tibialis anterior and posterior, peroneus longus and brevis, or popliteus and plantaris. The correct answer is A, that is gastrocnemius and soleus muscles. The Achilles tendon is formed by the gastrocnemius and soleus muscles attaching to the calcaneus. Question number 36. Which ligament is most commonly injured in ankle sprains? Your options are deltoid ligament, anterior talofibular ligament, posterior talofibular ligament, or calcaneofibular ligament. The correct answer is anterior talofibular ligament. The anterior talofibular ligament is the weakest lateral ligament and is commonly injured in inversion ankle sprains. Question number 37. The femoral nerve does not supply which muscle? Your options are sartorius, rectus femoris, vastus lateralis, or adductor magnus. The correct answer is D, that is adductor magnus. The adductor magnus is supplied by the obturator and tibial nerves, not the femoral nerve. Question number 38. Which artery supplies the gluteal region? Your options are femoral artery, obturator artery, inferior and superior gluteal arteries, or popliteal artery. The correct answer is C, that is inferior and superior gluteal arteries. These arteries, branches of the internal iliac artery, supply the gluteal region. Question number 39. The ligament that prevents anterior displacement of the tibia is posterior cruciate ligament PCL, anterior cruciate ligament ACL, medial collateral ligament MCL, or lateral collateral ligament LCL. The correct answer is B, that is anterior cruciate ligament ACL. The ACL prevents the tibia from sliding forward relative to the femur. Question number 40. Which of the following is a primary flexor of the hip joint? Your options are iliopsoas, gluteus medius, biceps femoris, or adductor longus. The correct answer is A, that is iliopsoas. The iliopsoas formed by the iliacus and psoas major. It is the main flexor of the hip joint. Question number 41. The tibial nerve runs through which compartment of the leg? Your options are anterior compartment, posterior compartment, lateral compartment, or medial compartment. The correct answer is B, that is posterior compartment. The tibial nerve innervates the muscles in the posterior compartment of the leg. Question number 42. Which bone forms the heel of the foot? Your options are talus, calcaneus, cuboid, or navicular. The correct answer is B, that is calcaneus. The calcaneus is the largest tarsal bone and forms the heel. Question number 43. The pes anserinus is a common insertion for all except sartorius, gracilis, semitendinosus, or biceps femoris. The correct answer is B, that is biceps femoris. The biceps femoris inserts on the fibular head, not at the pes anserinus on the tibia. Question number 44. The longest vein in the body is the femoral vein, great saphenous vein, popliteal vein, or small saphenous vein. The correct answer is B, that is great saphenous vein. The great saphenous vein runs from the foot to the groin and is used in coronary bypass surgeries. Question number 45. What structure passes through the tarsal tunnel? Your options are posterior tibial artery, tibial nerve, flexor tendons, or all of the above. The correct answer is D, that is all of the above. The tarsal tunnel houses the tibial nerve, posterior tibial artery, and tendons of flexor muscles. Question number 46. The rectus femoris differs from the other quadriceps muscles because it extends the knee, it flexes the hip, it adducts the thigh, or it rotates the hip. The correct answer is B, that is it flexes the hip. The rectus femoris crosses the hip and knee, aiding in hip flexion and knee extension. Question number 47. The muscle responsible for eversion of the foot is tibialis anterior, peroneus longus, soleus, or flexor hallucis longus. The correct answer is B, that is peroneus longus. The peroneus longus, located in the lateral compartment, assists in foot eversion. Question number 48. Which bursa is most commonly inflamed in the knee? Your options are suprapatellar, prapatellar, infrapatellar, or semimembranosus. The correct answer is B, that is prepatellar bursa. The prepatellar bursa, located anterior to the patella, is commonly inflamed in housemaid's knee. Question number 49. The medial meniscus is firmly attached to which ligament? Your options are ACL, PCL, MCL or LCL. The correct answer is C, that is MCL. The medial meniscus is attached to the medial collateral ligament, making it more prone to injury. Question number 50. The plantar reflex tests the integrity of which nerve roots? Your options are L2, L4, L4, S1, L5, S2 or S1 to S2. B, that is L4 to S1. The plantar reflex, also known as the Babinski sign, tests the function of the L4, S1 nerve roots. Time is to comment your score out of 50 questions. And friends, thanks for joining us on this exciting journey. If you enjoyed the quiz and learned something new, then give us a thumbs up and let us know in the comment section. And don't forget to subscribe and hit that notification bell so you never miss out on our upcoming exploration of fascinating topics in the medical field. Until the next time, stay curious, stay healthy. See you.